Hey everyone, welcome back to Knowledge Park. Today we're explaining male ejaculation in simple steps. It isn't just one moment, it's a careful teamwork between your brain, your nerves, and your reproductive system. We'll walk through the whole path from the first spark of arousal to the final climax and share a few helpful tips at the end. Let's get started. It all starts in your brain. A thought, a look, a touch, or a smell lights up the brain's pleasure and arousal areas. That activates the autonomic nervous system, the body's automatic control network. The first helper here is the parasympathetic system, your calm and restore mode. It slows things down, relaxes certain tissues, and, here, helps begin an erection by getting the body ready. In short, mind and body start working together for sexual arousal. From the brain, messages travel down the spinal cord to the pelvis. Those signals tell blood vessels in the penis to relax and open. More blood flows in, and the erectile tissue firms up. An erection. At the same time, the reproductive glands start preparing, so fluids and sperm can be moved when needed. Quietly, the body is setting the stage for the main event. A signal races down the spine to pelvic nerves, opening vessels and starting subtle penile changes. As arousal builds, your body prepares semen. Semen is not one liquid. It's a mix made by several glands working together. First, sperm. They form in the testes, your testicles, and then store and mature in a small tube called the epididymis. During arousal, sperm move into the vas deferens, two strong tubes. These tubes carry sperm toward the urethra, the body's exit path. The seminal vesicles add a sweet, fructose-rich fluid. This gives sperm energy and makes most of the semen, about 60 to 70%. The prostate adds a thin, milky, alkaline fluid. Alkaline means it lowers acidity, protecting sperm in the urethra and vagina. The Cowper's glands, also called bulbourethral glands, release a few drops of pre-ejaculate, or pre-cum. It helps clear leftover urine from the urethra and adds lubrication. All of these fluids join in the urethra. Together, they form semen. First, get a clear yes. Talk about what you both want. Check in as you go. Share boundaries. Respect them. Go slow together. Breathe slowly. It calms nerves and boosts arousal. Make your exhale longer than your inhale. Feel-good hormones help you connect. Explore at a comfy pace. Try gentle, warm, or cool sensations. Add a scent you both like. Use eye contact. Kiss, caress, massage. Noticing sensations helps your body relax and arouse. This supports natural lubrication and erection. Keep the pace unhurried so signals flow smoothly. Keep steady breaths. Lightly engage your core. Gently engage the pelvic floor for better control. You may notice a slight scrotal lift. A warm skin flush is normal. Heart rate rises. Notice it. Don't rush. Agree on pace and simple signals. Use protection and lube for comfort and safety. Sip water. Adjust angles or add pillows for comfort. You can pause or change consent anytime. Arousal is already high. Touch and stretch on the genitals send fast signals up the spinal cord to the brain. The parasympathetic system keeps the erection. The sympathetic system slowly rises. Heart rate picks up. Breathing quickens. Focus narrows. A light flush can appear. Blood keeps filling erectile tissue to stay firm. Gentle pelvic floor engagement matches a steady rhythm. Slow your breath. Add small pauses or change angles to ease the build. Pre-ejaculate from the bulbourethral glands may show up. It clears and lightly lubricates the urethra. Protection still matters. At the plateau, muscles in the core and thighs tense. The scrotum lifts and attention tightens. Up and down thrusts create stretch and pressure at the glands. The tunica and ligaments help trap blood for firmness. Light-based compression limits outflow. Hips and core drive smooth motion. A steady rhythm reduces hot spots. Slower, deeper strokes prolong the plateau. Faster, shallower strokes speed arousal. Adjust together. Receptors on the glands and shaft activate the pudendal nerve. Signals reach the spinal cord and brain. Sympathetic tone keeps rising. Breathing and heart rate climb. Bulbourethral glands increase pre-ejaculate. The vas deferens moves sperm forward. Seminal vesicles and the prostate boost their fluids. The bladder sphincter starts to close. The body is getting ready for a mission. The point of no return feels like pelvic tingles and a sense of inevitability. Stage 1. Emission. Ducts and glands contract, moving semen into the urethral bulb. The bladder sphincter closes to block urine and backflow. Stage 2. Expulsion. The bulbospongiosus and pelvic floor muscles fire in rhythmic bursts, about 0.8 seconds apart, pushing semen out in spurts. The whole body peaks. Fast breath, racing heart, dilated pupils, maybe a brief shiver or sound. Right after, sensitivity is high. Oxytocin and endorphins support warmth and closeness. Prolactin helps begin the refractory period. Through it all, keep consent, communication, protection, hydration, and pelvic floor training in mind. Right after ejaculation, your body enters resolution. Blood flow returns to normal. The erection softens naturally. Heart rate and breathing slow. This is normal and temporary. Next is the refractory period. In this time, another orgasm or ejaculation isn't possible. Your body is resetting hormones and nerves. The length varies, minutes to hours. Age, health, stress, sleep, and arousal all play a role. Be patient, hydrate, and relax. Now that you know the basics, here are simple, practical tips to support sexual health and control. Build your pelvic floor. Find the right muscles by briefly stopping urine once, then practice off the toilet. Squeeze, hold for 5-10 seconds, relax, and add light pulses. With practice, you'll gain better control and stronger orgasms. Drink water throughout the day. Good hydration supports semen volume and overall comfort during sex. Retrograde ejaculation can send semen into the bladder instead of out. It's often harmless and linked to certain medicines or conditions. If it's frequent or concerning, talk to a doctor. Your mind matters. Stress, worry, or distraction can disrupt arousal. Use slow breathing, focus on sensations, and take short pauses to reset. Orgasm and ejaculation aren't always the same. Dry orgasms can happen and are usually harmless. See a doctor if they're persistent or troubling. Pre-ejaculate may carry sperm and sexually transmitted infections. Use protection even if you don't plan to ejaculate. Build meals around whole foods, vegetables, fruits, legumes, whole grains, nuts, seeds, olive oil, and lean proteins like fish or poultry. This supports hormones, blood flow, and stamina. Key nutrients: zinc and selenium for sperm quality, omega-3s for cell membranes and circulation, B vitamins for energy, vitamin D for hormones, antioxidants like C and E to reduce oxidative stress. Aim for clear urine. Limit alcohol. It can lower testosterone and erection quality. Use caffeine in moderation and avoid it late to protect sleep. Move regularly. 150 to 300 minutes a week of moderate cardio, or 75 to 150 of vigorous, plus 2 to 3 days of strength training. Expect better circulation, mood, endurance, and ejaculatory control. Practice Kegels off the toilet. 3 sets daily of 10 slow holds, 5 to 10 seconds each, plus 10 quick pulses. Breathe naturally and avoid squeezing abs or glutes. Protect the basics. Sleep 7 to 9 hours. Manage stress with breathwork or mindfulness. Keep a healthy waistline and avoid smoking or vaping. Review medicines with a doctor if erections or ejaculation change. Common variations include premature, delayed, or absent ejaculation. often benign. Seek care if they persist, are painful or distressing, or appear suddenly. Contributors can include stress, pelvic floor imbalance, and some medicines. SSRIs may delay ejaculation. Alpha blockers can cause retrograde flow. Try paced breathing, start-stop, the squeeze technique, and pelvic floor training with relaxation. Aftercare matters. Pee after sex, wash gently, drink water, and debrief with your partner. Remove the condom carefully, tie it, and throw it in the trash, not the toilet. Quick wrap-up. Semen basics. Most ejaculates are about 2 to 5 milliliters. Most volume comes from the seminal vesicles. Sperm plus protective prostate fluid make the rest. Color ranges clear to whitish. Volume varies with hydration, time since last ejaculation, and arousal. See a doctor for persistent pain, blood, strong odor, or sudden changes. Semen typically smells slightly chlorine-like and tastes mildly salty or sweet with an alkaline note. Diet, hydration, and time since last ejaculation affect both. Strong odors or sudden changes, see a clinician. Sexually transmitted infections testing, at least once a year if you're sexually active. Every 3 to 6 months with multiple or new partners. Protection still matters. Testing is routine, quick, and confidential. Balance Kegels with relaxation. Breathe diaphragmatically, lengthen your exhale, and add gentle hip and pelvic stretches. A relaxed pelvic floor improves comfort, blood flow, and control. And that's the journey. Brain, nerves, vessels, and muscles working in sync. During climax, dopamine, oxytocin, and endorphins spike. Afterward, prolactin rises to support relaxation and the refractory period. Blue balls. Epididymal hypertension is usually harmless pressure. Time or ejaculation helps. See a clinician if pain is severe or persistent. For concerns, see a urologist for urinary pain or infections, erection or ejaculation changes, blood in semen or urine. See a urologist andrologist for male fertility issues, low testosterone or hormonal concerns, testicular prostate problems, or penile curvature like Peyronie's. See a sexologist for low desire, performance anxiety, rapid or delayed ejaculation without medical cause, or relationship behavioral concerns. If this helped, like, subscribe, and hit the bell. Thanks for watching.